For nearly 20 years, Representative Tom Price worked in private practice as an orthopedic surgeon. Before coming to Washington, D.C., he returned to Emory University School of Medicine as an assistant professor and medical director of the orthopedic clinic at Grady Memorial Hospital in Atlanta, teaching resident doctors in training. Congressman Price currently serves as the chairman of the House Republican Policy Committee, and he also sits on the House Committee on Ways and Means and the House Budget Committee. Thank you, Congressman Tom Price, for joining us.
I'm honored to be with you. Thank you ever so much for the opportunity.
Wonderful. In a televised statement last week, you mentioned, as a physician, I can tell you that doctors and patients of this land are very troubled because this law, just like yesterday, hasn't changed today. And it violates every single principle that we hold dear as a nation in healthcare. Would you like to elaborate on that, Congressman?
Absolutely. And I've been so distressed, truly, since the ruling came down by the calls that I've received from my fellow physicians across the country, many of whom are just absolutely distraught and not certain that they're going to be able to continue in the profession. When I talk about the principles of health care, I speak of 6 of them. Most folks talk about the top 3. They're accessibility, affordability, and quality. And I add 3 principles to that: responsiveness, innovation, and choices. We need a system that is accessible for folks, affordable, of the highest quality, is responsive for people, continues to promote the highest amount of innovation, and allows patient choices. And if you look at each and every one of those, we can see that the law of the land now, as determined by the Supreme Court of the United States, violates each and every one of those principles, and that's why it's wrong. The Senate won't take up another vote of repeal of this piece of legislation that is so onerous to America. But that's not the sole point of passing a piece of legislation in one chamber. Elections are about contrasts, and it's important that the American people know that there are men and women in Washington fighting just as hard as we can to respect their wishes, their desires, and their needs, and recognize that this law is again, violative of the principles we hold dear, and therefore we will vote to repeal it once again on July 11th, and then send it to the Senate, and hope and pray that the 23 Democratic senators who are up for re-election this year hear from their constituents about the imperative of repealing this law, and if not, that the American people send a message loud and clear in November to Congress to make it so that the House remains in Republican hands, the Senate turns into leadership that recognizes the imperative of this repeal, and we elect a president who understands the necessity for patient-centered health care and the repeal of this law.
Congressman, this is Becky Dunlop. You mentioned of your 6 points, affordability and patient choice. And Bob Moffit was with us a bit earlier on the program, and he talked about how if we had greater competition in the United States among providers, that it would, first of all, offer patients more choice, and second of all, competition generally makes things more affordable. I'm wondering if it would be a useful exercise for you and your colleagues, once you do pass a bill to repeal Obamacare, you and your colleagues in the House, to actually begin holding hearings, perhaps even field hearings, on this idea of how competition helps patients have more choice and affordability, and really bring that message out as something that you're thinking about as a way forward if the Senate would act and also repeal Obamacare.
Oh, it's a great idea, and we've had multiple hearings, as you well know, in Washington. But field hearings are so important because they take the issue to the American people, and it's a great idea. I'll take that back. I am so I am received with such enthusiastic warmth across the country when I talk about health care, because people know that Washington ought not be in charge of our health care system, whether it's the physicians of the land or employers or patients, individual citizens. They understand that the last thing we need is to have Washington be in charge of our health care.
Well, we hear that too, of course, and yet I was watching an interview the other day of the Speaker of the House, and of course he was very, very strong on we need to repeal Obamacare. But when he was pressed for what's the alternative, his only response seemed to be, well, we're going to have hearings and look at this very carefully. the only reason I mentioned this idea about affordability and choice is because it would take an idea that you folks have talked about and actually put it out there to say, well, this is the beginning of what we're talking about. And there are probably 2 or 3 other things that I haven't touched on that you've already thought about. But I would encourage you to begin the dialogue with the American people out in the field so that they understand there actually are options to this.
No, you're absolutely right, and that's so important. And I think the speaker is spot on, though, to talk about hearings, because one of the things that angered the American people so much about this law being put in place is the process that was used to put it in place. And the speaker and many of us have said over and over, look, we will not repeat the mistakes of the Democrats. We want a rational, thoughtful, deliberative, open, transparent, bipartisan process that gets us to the right answers regarding patient-centered health care.
Right. Congressman Price, if you could maybe compare for us resistance that you would expect from different stakeholders versus Obamacare or a brand new program that would be put in place, as you mentioned, on those 6 principles. So how would hospital owners, insurance companies, drug makers, and patients respond to, obviously through lobbying now, for Obamacare versus towards a completely brand new plan on those 6 principles that you mentioned?
Yeah, it's a great question because folks say, well, look, what you talk about makes so much sense. Why would anybody be opposed to it? And when you step back and appreciate what motivates many people in this discussion, a lot of the folks that you mentioned, especially some of the industries in healthcare, they want to side with the people in Washington that are going to ensure that they come out a winner in the system. And the only person that I believe, the only entity that I believe needs to be a winner in the system is patients. If we keep patients at the focus of all of this, we'll be in great shape. But what that means is that the outcome for, as you say, the pharmaceuticals or even my fellow physicians or the hospital entities or the home health care folks or whomever you might define, the outcome for those folks is not a given because we would put patients in charge. If we allow patients to be the ones that are controlling the system, and it's relatively simple to do by allowing patients to own and control their health coverage regardless of who's paying for it. If we put patients in charge, then the system moves in the direction that it ought to move. That's the direction that patients want it to move, not anybody else. But it's an unpredictable outcome, and there are a lot of people in Washington who are just real skittish when it comes to them not being able to dictate to people and to define what the outcome's going to be.
Boy, we sure like to hear that. Patient-centered. I would be remiss, Congressman, if I didn't mention that the Heritage Foundation has put out a number of papers that talk about different options that encourage patient-centered health care, which would be available to our listeners today, and of course certainly is available to members of Congress on the Heritage website, heritage.org. I know you're familiar with a few of those.
Absolutely, Becky, and in fact, I was being interviewed by a national news outlet a couple days ago, and was asked where some of these ideas come from, and I actually mentioned heritage.org, and they said, well, they may have a certain perspective, and I said they absolutely do. It's called freedom.
Congressman Price, I was just wondering if I could just take a minute or two of your time to what is happening in the Middle East in these days. In fact, Egypt had its presidential election. A new president has been sworn in. There's great concern about its implication. What are your thoughts, and how do you read things playing out in Egypt and in light of Israel, the state of Israel?
Well, I have said for a number of years now that I'm fearful that this is what the world looks like when the United States refuses to lead. The president has described his leadership style vis-a-vis this area of the world as leading from behind. That's the last place the United States needs to be. What we've seen is an unpredictability and an uncertainty among the players in the Middle East about what the United States response is going to be. And consequently, we now find Israel not able to be certain about what the United States' role in any potential conflict might be. and consequently it becomes less certain in what its relationship is with the United States. I had the privilege of visiting Israel and Jordan and Turkey earlier this year. Met with all three heads of state, and we were astounded when we learned of the number of leaks coming out of the United States administration, this administration, the Obama administration, as it relates to strategic military intelligence between the United States and Israel. So much so that the Israelis now are very concerned about their ability to share information with the United States because they're not certain that it's going to be kept in confidence. So very, very troubling time right now. And again, I'm afraid that this is what that area of the world and the world looks like when the United States refuses to lead. So it's time for the U.S. to lead. Well,
it does seem, too, it comes down to that age-old discussion about the priorities of the national government. And this whole area of the sequestration and what that will mean for our national defenses and our ability to lead. I wonder if you'd comment on that, Congressman.
Well, the sequestration, as you and your listeners will know, is the process under the Budget Control Act that was passed last year to make certain that we are decreasing the incredibly profligate spending at the federal level, but it needs to be done in a smarter, more intelligent way. A hatchet at our defense for our national security from a financing standpoint is just the wrong way to go. Can we save money in the defense arena? Absolutely. But there are ways to do it that are much smarter than just an across-the-board reduction in spending. And so what we in the House Republicans have done is gone through a reconciliation process that actually saves more money than the sequestration would, but does not do so by jeopardizing our national security. And that's what we would encourage the Senate to take up, as well as the President to adopt. But we seem not to have willing partners in either the United States Senate or in the administration at this time.
Thank you very much indeed, Congressman Tom Price, for joining us from the district today. And we certainly wish you the very best in your efforts in advancing liberty and being a tremendous spokesperson for the conservative movement.
Thanks so much. Take care. God bless.
Thank you so much, Congressman.